My name is Jonathan Weiss. I've been a physician for close to 30 years, although 10 of those were training, but I've actually been in practice 20 years, nearly so this upcoming June. I'm an internist, also board certified in pulmonary medicine and critical care medicine. And I grew up and was trained in the Philadelphia and Long Island area of New York. I found this very nice practice in Sullivan County, Sullivan Internal Medicine Group, which has been an ongoing medical practice here in Sullivan for something like 40 years. I believe we are the longest functioning medical practice in this county, and I think that speaks to our love for our patients and our patients' affection for us and the kind of care we give. What we bring to medical care in Sullivan that I think is special is again our sense of devotion to our patients, our level of communication. When you come here, you do not feel like you're in some corporate medical entity, being treated like a number on a lengthy line. I have a very personal relationship with nearly all of my patients, and I think that is what has patients coming back here year in and year out. My philosophy regarding medical care revolves around several things. Obviously, I need to do my part, staying up to date on medical knowledge, taking the time to communicate well with the patient, doing proper examination, asking detailed questions to get at the root of the problem, and doing whatever testing and treatments are necessary. But equally important in my mind is that everyone has to do their best to lead a healthy lifestyle. So much of good health is dependent upon the lifestyle that we lead, and I focus a great deal on that aspect of medical care with my patients, really pushing for things like proper exercise, good eating habits, controlling one's weight, certainly avoiding cigarettes and other tobacco products, moderate alcohol consumption and those sorts of things. What it is that got me involved in medicine in the first place, which is connecting with people, making a difference in their lives, trying to help them remain healthy where possible, and if they have illnesses that are progressive and persistent, to help them cope with it, to help them deal with it, to help family members understand what's going on. And when you reach out to somebody and touch them in those sorts of ways, and you hear back maybe later on, oh, thank you for getting me through that tough time, or thank you for being there when mom or dad was really sick, that really, as always, is the best part of being in healthcare. That that you've been able to help people through the tough times. The most important part of a medical relationship is how a doctor and a patient communicate with each other, how they relate to each other, how they set up a rapport with each other. And I think that in my own way, I have managed to hone those skills. Again, I can be very upfront, very straightforward, perhaps at times a little blunt, but in a way that's very caring. I'm not going to sugarcoat a situation. I'm not going to throw a lot of technical jargon at a patient that will leave them more confused than not. I'm very good at giving very clear-cut explanations in very straightforward language, so that a patient knows exactly what they're confronting, what they're dealing with, what their instructions are, what is expected of them in terms of coming back for a follow-up, or going to a specialist, or taking the medication, or doing a test. We pride ourselves as part of that communication in getting back to patients who call for questions. We're very fortunate in that we have a good-sized staff with a lot of services. We do x-rays on the premises, we do ultrasound on the premises, we do blood work, cardiograms, urinalysis. We have a devoted team of nurses who've been with us for many years. They too know the patients very well, and so there's this tremendous team approach and almost a family approach to what we do here, so that when patients come in, they can chat with my x-ray tech or my blood technician or my nurse as if they're talking to somebody in the family. It creates a great sense of comfort when people come here. One of the new things that we've done after being a solo practice here in Sullivan County for 35 or 40 years is merge with Middletown Medical, a company based in obviously Middletown, New York. And this has proven to be a great opportunity for us because Middletown Medical, by virtue of its size and its resources, allows us to very easily bring to our patients additional levels of care. We are now in a position to bring specialists right here into our office to provide special services, whereas in the past we would have to send patients often great distances to see a specialist. So already we have a Middletown medical cardiologist spending time here in our office seeing our patients, as well as an orthopedist, and we anticipate expanding those opportunities to other specialists in the months and years ahead. We have access to additional diagnostic equipment in Middletown Medical's main building in Middletown. So we see this as a great step forward in allowing us to enhance our practice, offer even additional services to our patient, while still retaining that close, intimate, comfortable family feel that has always been the hallmark of Sullivan Internal Medicine Group. Some of the things that I like to do outside of medicine, again, here we live in the beautiful mountains of Sullivan County. I love hiking, I love biking. Where possible, I like to get on the ski hill and do a little skiing with my sons. Those would be my main activities outside of work, of course, other than just being with my family.